The scariest thing that we're having to deal with, and this is probably going to make me really emotional, is that at this time our evening staff are attending to multiple overdoses a night outside the building when the safe consumption site is closed. Nobody's going to be there, and that's a really scary thing to try and come to terms with. Sorry. For the last couple years, we've been able to keep the drop-in center and the safe consumption site open from 10 a.m. to 10 p.m. every night. We are the only location open in the evening for the people in this community. We are also the only public washroom. Effective May 1st, due to a multitude of reasons, we are no longer going to be able to operate past 4 p.m. every day. We have, in the last few months, seen an increase in demand by over 200 new individuals accessing services, which requires us to have a lot more staff on site. It's well known that our safe consumption site is not properly funded and that we rely on donations. The operations of our drop-in center is piecemealed together by various donations, and at this time we have a prospective $65,000 to operate this year. This has been an incredibly difficult decision because we know as of May 1st, when the doors lock at 4 p.m., there is nowhere for people to go. We have seen a very steady increase in overdoses in the evening, and our staff, whether there's a paramedic on site, have been attending to multiple outside the building. As of May 1st, there will be nobody to provide support to those overdosing outside the building. Like I said, this was an incredibly hard decision. It's not one that I was hoping to have to make this year, but the reality is with hundreds of more people needing services, our building and our staff currently cannot manage. At this point, to operate and meet demands, we're looking closer to $450,000. Our drop-in center has never been core funded. We get funding from the Ministry of Health for our case management team, but they work in community. They don't run the drop-in center. When we built this space, and it was intended directly to support the safe consumption site, we anticipated about 30 people, and we've now tripled that at a time, and we just don't have the space. Our day staff need more capacity and more support to deal with the volume of people. And for evening staff, we're looking at possibly 6-7 full-time positions needed to manage what we're dealing with. It is absolutely shocking that our province has made decisions without considering our people that are living on our streets. We know the numbers are growing. We know the lack of housing. We know the lack of financial support. And year after year, we're seeing less and less money being put into this community. I really do feel like it is the government's responsibility to step in and make this better and do what is actually needed to support this community. Creating more treatment beds right now is not the solution. We need to keep people alive.